my sister-in-law was only 22 months different than my wife, and they talked every single day. We had just been on vacation with my sister-in-law in Montana. She was in the middle of getting her MBA. She was a physician leader. She was had no prior history of mental health issues, which has been frankly one of our biggest awakenings, which is how quickly this ship can turn, if you will. She contracted COVID. She really tried to recover from COVID by herself at home in her apartment in Manhattan while trying to run an emergency room remotely. And then when she went back into that workforce, many 12+ hour shifts in a row, the volume of just death and dying on an already depleted worker because she was not really recovered from COVID was just way too much for any one person to bear. It was truly a perfect storm. And so all of a sudden we saw this person who had been working at the top of her game, professionally, personally, in every possible way, was just, her legs got cut out from under her in a flash. That was probably one of the biggest lessons that we learned as to how quickly something like this can turn. And it was a complete and total shock on every possible way. As you step back and what we've learned, particularly around the stigma associated with getting help and all of the pressure that she had on her professionally, it shouldn't be a surprise now, but because of those factors. But this certainly wasn't someone who suffered from mental health conditions or depression for years that we were kind of waiting for this. There was none of that on the radar at all. This was really a byproduct of working to yourself to the bone, literally, and then getting help and having that help be something that is so stigmatizing that it puts you over the edge. As the co-founder of the Dr. Lorna Breen Heroes Foundation, I'm helping to raise awareness across the country and support the well-being of the healthcare workforce, both doctors and nurses. And as part of that, we're working on both federal and state legislation, as well as a large nationwide campaign to get all hospitals and health systems to commit to the well-being of the workforce and give them the tools to support the workforce.
It's still common practice in this country for state medical boards and hospitals to ask doctors seeking licensing and credentialing whether they have ever been treated for depression or other mental illness. This heightens the barriers to asking for help when we should be making it easier to do so. And when Lorna became so overworked and despondent that she was unable to move, do you know what she was worried about? Her job. She was worried that she would lose her medical license or be ostracized by her colleagues because she was suffering burnout due to her work on the front lines of the COVID-19 crisis. She was afraid to get help.
There are at least 4 layers of this kind of regulatory reinforcer that says getting help yourself is not okay and is not acceptable. So you have the built-in pressures of the profession, you have the built-in competitive nature of it, the long commitment. You have people who go into it because they are about taking care of others and not before themselves. And then you have this framework around them, these trappings around them, which keep them silent.
Dr. Breen's family is devastated by her passing, but they're honoring her by advocating for the cause of a more humane profession, one in which mental health challenges are acknowledged, mental health resources are available, and a healer accessing those services is encouraged. I'm proud today to introduce the Dr. Lorna Breen Healthcare Provider Protection Act, together with my colleagues.
We are overwhelmed with over 70 organizations across the healthcare community who have said this is the right thing to do, as well as the administration and the Health and Human Services Department within the federal government has said nothing like this has ever existed, and it's desperately needed.
The act aims to reduce and prevent suicide, burnout, and other mental and behavioral health conditions among healthcare professionals.
The licensure issues are real and they're pervasive and they're highly inconsistent from state to state. And so we are working with a consortium of organizations to try to evaluate those laws and change the licensing laws.
How should we honor the work and sacrifice of a Lorna Breen? How do we honor those healthcare frontline workers that we call heroes every day? How do we recognize the tremendous work they're doing and also the tremendous burden that they carry? Let's pass this bill and show that we care about our healers and are committed to providing them the resources and the culture they need to keep healing.
That's where we're started. We've got a long road ahead, but we are, as we've said multiple times, we're just getting started. We've got the wind in our sails, and we're going to make this happen for the healthcare professionals who've given so much of themselves.